All right, what is going on, everybody? Hope you all are doing well. Welcome to another lecture series. So today we're going to be talking about concussions. You may have heard of them. They're very common, especially for athletes. So what a concussion is that it's essentially an alteration in mental state that results from injury to the head. And it typically arises, it can be anywhere from sports injuries, vehicle accidents, falls, hits the head. When you think about the brain, it's encased by three coverings. The first is the meninges, which is a protective layer of cerebral spinal fluid. And this structure is what kind of supports the brain and helps the brain to kind of float around within the skull. During any type of high velocity collision or impact, the brain and the skull move together until the body hits resistance and suddenly stops. And after the body stops, the brain continues to move until it collides forcefully with the inside of the skull. Right? So you have a situation where your brain is making impact with the skull, and then that can occur as a point of impact or coup injury. And then this is where the brain kind of bounces back and hits the opposite side of the skull. So you essentially have something where when it hits the front, it's coup. When it hits the back, it's counter coup. And you have this injury where the brain is essentially being injured within itself. The neurons are stretched. They're sheared. They're transected. They're kind of cut into different pieces. And this is what leads to the concussion symptoms. When we think about people who have gone through multiple concussions, perhaps there's some mental cognitive changes. There could be some personality changes as well, but those symptoms are arising sometimes within minutes to hours after the injury. And this could include just some distant stares into space, disorientation, inability to focus, especially if it's in the prefrontal cortex area, some memory impairment, depending if you get hit on the side of the head. So there's a number of different things that can happen in regards to concussions. Not all concussions are the same. So for example, in this situation, you'd typically would see the full neuron signal go all the way through, and it's not. It's just kind of stopping, right? So you have a transected and damaged neuron that isn't able to transmit the full signal. It's a slow recovery. Typically, it can happen anywhere from 6 months to 2 years. So you can imagine if someone is having multiple concussions, that is not good. In fact, I've had friends who their doctor literally told them that if they have one more concussion, and at this point they had like 5 or 6, they were like, if you have one more concussion, this could seriously, severely damage your brain to a point where some of the damage could be irreversible. When you think about certain sports like contact sports, football, boxing, wrestling, the reason why there sometimes is so much controversy within these sports is that if someone is getting multiple concussions, the potential damage, long-term effect of this could be very severe. All right. So just be aware of this. This could be some really good information. For example, for someone who has gone through a traumatic brain injury and maybe they're working with their psychiatrist in terms of perhaps medications for the migraine or the headaches, for you to be able to give some of that psychoeducation, I think is going to be pretty pivotal. And there are different types of treatment plans from a cognitive behavioral therapy standpoint that could help these patients as well. So, but I think for your benefit, hopefully that can provide just a little bit of an overview of perhaps what is exactly happening within the brain.